Welcome to Reframe Summit 2023, a transformative gathering dedicated to reshaping our perspectives on mental well being. Today, on the occasion of World Mental Health Day, we embark on a crucial journey to explore the intricate relationship between stress and periods in a discussion aptly titled How Period Taboo Affects Women's Mental Health. At She the People, our vision is clear to address the urgent and sensitive mental health issues that often linger in the shadows. We believe in fostering open dialogues, sharing diverse opinions, and working collaboratively to create a healthier mental landscape for all. But let's remember, we are not here for monologue, we are here for dialogue. A conversation that extends beyond the stage and reaches into the hearts and minds of everyone present. First, let me introduce Dr. Ruchi Tandon, an accomplished gynecologist and the founder of Queen's Gynecologies, whose vision is to provide judgment free healthcare for younger women. Her medical expertise, especially in the field of gynecology, brings a unique perspective to our discussion today. Alongside her, we have Vaishali Garg, a journalist whose work has covered numerous conversations with experts on menstruation. Her insights into societal perceptions and stigmas around periods are invaluable. Lastly, we have Dr. Supriya Malik, a developmental psychologist and the founder of Embrace, a pioneering mental health startup. Dr. Malik's work in providing accessible assessment and therapy services in India reflects her commitment to improving mental well being. So, let's get the discussion started. From the challenges women face in workplaces and educational institutions to the far reaching implications of mental health, we aim to shed light on this vital topic. We will explore societal taboos, emotional responses, and the psychological impact of menstruation. Today, we are not here just to talk. We are here to inspire change, to break the silence, and to ensure that no one's mental well being is compromised by factors beyond their control. So, let's reframe the narrative together. Welcome to the Reframe Summit 2023. So, now let's dive into our discussion. Imagine the anticipation and sometimes apprehension that comes with the thought of menstruation. Everybody has a unique way of handling cramps, fatigue, mood swings, and other challenges, all while dealing with different living conditions, societal biases, lack of awareness, myths, and sometimes even shortage of resources like menstruation products. So, my question to you is how these societal conditions can affect women's health and their mental stress levels. Dr. Ruchi Tandon?
Thank you for the kind words, Oshi. Stress is a part of being alive, and our bodies are well protected from most of the effects of stress. Stress has a deep impact on your period cycle. Some of the changes that you can notice because of urbanization can be delayed periods, absent period, missed period, a more painful period, a more prominent PMS or more of premenstrual symptoms that are being exaggerated, bleeding in between periods, or any unexplained vaginal bleeding. Now, there is a deep relation between stress and period. Stress changes your period pattern, and vice versa, a change in your period pattern can lead to stress. Now, what you can do if you have stress impacting your cycle is completely different. Of course, a lot of these, provoking factors that lead to stress are inevitable, especially in the urban women. And there are certain techniques which we also explain to them how you can reduce them. And these particular symptoms are the symptoms that you have to watch out to. And in case you have any of the above symptoms, of course, first of all, you rule out the common, causes of these. If there is no pathology involved, there is a way that these can be treated.
Thank you so much for giving such an insightful answer for this question that I think every woman has in their minds. Now, my question is to Dr. Supriya Malik. As a developmental psychologist with expertise in therapy, you understand the psychological impact of stress. How does the stress associated with menstruation affect women's mental well-being, and what are the some common emotional responses during this time?
Thank you, Oshi. Um, yes, I mean, stress affects us all, like Dr. Ruchi said, all the time in different phases. But during period, it's the stress of not just the societal factors, but the emotional changes that one is going through, right? So you can experience irritability. There'll be frustration. Some people experience it as anxiety when the stress actually increases. You'll also experience sleeplessness sometimes. Some people complain of insomnia, or some people complain of wanting to sleep more. So there are different, responses that everyone can have. And stress can sometimes exaggerate these responses. So, what happens when we're already stressed and we are getting when we are getting our periods, is that we are starting to feel all those emotions more intensely, and when that happens, it can obviously affect our mental health. We are starting to feel emotional very quickly. That has an impact on how we're going to be interacting with other people, how we're going to take on different kinds of feedback from the environment. So I think overall stress can exaggerate some of those emotional symptoms that we're feeling, but it can also be vice versa, because what happens is when we are starting to feel irritated and when we are starting to feel frustrated, we are going to get stressed even more. That why is this happening to me? What is wrong with me? That's the common question that women will come with, saying, "What is wrong with me?" And that is the bit which is starting. As soon as we starting to get into that cycle of what is wrong with me, you're starting to think and overthink, and that sets into a cycle of mental health issues.
That's something that I think the frustration that you mentioned, as I think everybody of every age group has felt once in their lifetime. So now let's circle back to the societal taboos that we were discussing before. The topic of menstrual stress often intersects with the societal taboos and stigmas. So I'm asking this question to all of you. Can you shed light on how these societal attitudes contribute to the feelings of shame, anxiety, and stress among menstruating individuals? Dr. Supriya, you can go first.
Sure. I think they have a very big impact on how we are dealing with stress and all the emotional symptoms during menstruation. Uh, the biggest impact would be, sharing our feelings or accepting just the fact that we are going through this, because most women start wondering, is there something wrong with me? What is going on? Who do I even talk to about this? Is a big question in people's mind. And what happens often is that you shun the feeling away, you try and bottle it up, you try and push it away. And so that's big. That's one of the biggest challenges. But also I think just the fact that we don't talk about menstruation so much is is where the stigma starts, is where the problem starts. So I think that would be my take on it.
Dr. Ruchi, I'm assuming that lots of patients comes to you with lots of inhibitions in their mind, and because they're not able to talk about this topic, I think it is mostly because of the stigmas around. So, have you experienced any patient coming up to you and telling about these societal taboos that they have faced, and it has worsened their medical condition?
Yes, Oshi, we do see a lot of patients that come with, menstrual, conditions, and especially a lot of younger generation women who are more empowered than their prior, generation. Now, there are two things in this. Number one is, lack of awareness. Probably the earlier generations used to think that any abnormal period is normal, or a single period miss ho gaya to chalta hai. But I guess with so much of social media and so much of education and exposure to the younger women are much more empowered, and they feel that they can easily discuss their conditions with a gynecologist. And sometimes the second thing is these conditions may be associated with another condition. For example, she might be having some thyroid disorder. She might be having, abnormal uterine bleeding because of endometriosis, or she might be having a fibroid. So these things were priorly, they used to go missed. But because of the increasing awareness, and maybe because women are much more empowered, they take the step forward and they openly discuss their symptoms with gynecologists, in turn, helping themselves. If we catch these things earlier, we can help them much more. So every woman should be more empowered and feel more comfortable in discussing their symptoms with a gynecologist rather than just Googling their symptoms.
Vishali, I believe during your interactions with experts on menstruation, you might have come across stories or examples that highlight the challenges of women facing menstrual stress in different cultural contexts. So, how can awareness and dialogue address these challenges, and what are the societal taboos that you have witnessed during your interactions with these experts?
Yeah. So, first thing, during periods, we all are dealing with some hormonal changes and all. But, the top it off, there's still way too much secrecy and shame around periods in our society. All of them somewhere share some type of secrecy, some type of embarrassment. And, this secrecy can pile on the stress and anxiety. People might feel like ashamed or embarrassed to talk about periods, and that can make them feel like they have to hide their symptoms, and it's a challenging experience for them. So if we talk about periods open hearted, just break the chains of silence, we can talk more about it, and many girls feel empowered to talk about periods.
So now coming from the like a question coming from the rural background, multiple researchers in past have underscored millions of girls dropping out of school every year due to lack of adequate menstrual hygiene facilities and knowledge. How does this educational gap affect their long-term mental health and prospects in life? So this question is for all of you to share your insights and expertise, because it's something that is, it's a pressing issue that needs to be highlighted amongst all of us.
See,
Vaishali?
when you're in your menstrual cycles, that time we are already dealing with a lot of things. Sometimes a small task looks like a mission to mass, and that time if we ask somebody कि आप अपने symptoms मत बताओ, mostly rural areas में, गांव में लोगों को बोला जाता है कि अपने सिम्टम्स को छुपाओ, ऐसे मत बताओ, इट्स अ कॉमन थिंग. सो ये जो होता है, ये उनको मेंटली काफी अफेक्ट करता है. तो यहाँ पे उनका एजुकेशन जो होता है, वो तो अपने आप वो धीरे धीरे वो कॉन्फिडेंस ही नहीं होता उनमें कि हमको जाना है. तो मेन चीज ये है कि जब हम वहां पे जाके लोगों को ये चीज बोले कि नहीं, इसके बारे में ओपन हार्टेड कन्वर्सेशंस होनी चाहिए, हम लोगों को बताए क्या इम्पोर्टेंट है, क्योंकि जब तक आप बोलोगे नहीं, इट्स नॉट पॉसिबल कि हम किसी का सॉल्यूशन लेके आ पाए.
Dr. Supriya, as a psychologist, what is your take on this stats that millions of girls are dropping out of school because there is no like there is lack of facilities and knowledge about this taboo, and it can affect your mental health. So what is your take as a psychologist on this?
So, you know what, I'm going to add to what Vaishali said. You know, there are lots of girls initially who will also say things like that I think there's a disease, you know, mujhe kuch ho gaya hai. Then because of that, so it shows actually how much lack of awareness there is, in that strata. So one is, of course, education has a huge impact on just, women becoming aware that this is a natural part of being a woman. The other thing is that, of course, lots and lots of families don't support girls or women who are having their periods at that time, when they are going through menstruation. So a lot of them are asked to stay at home. A lot of them are asked to not go out, which can, of course, impact the education, levels also, because they're not being allowed to even go to school, just because they have got their period. So I think that the more aware we are going to make our women, the more aware we are going to make our men, and have these open dialogues. It will, open up also at a rural level. How much people are starting to talk about menstruation and accepting it as a natural part of being, being a woman.
Dr. Ruchi, what's your take on this? Given a lot of girls drop out of school every year because they think with periods they cannot have a proper education.
See, as a gynecologist, the important thing that has to be done in our society is menstrual hygiene awareness. This is what we call it. And a lot of camps need to be, done, especially in the rural areas, to enlighten them that menstruation is not taboo. It is completely normal, and it should not inhibit your education in any form. Because as we know, an uneducated woman will be a burden to the society as well as her family. So, a lot of awareness camps have started happening in the past few years. And along with that, they need to be taught the importance of how to handle menstruation. For example, women still do not know that sanitary pads have to be used. And in order to reduce their cost or to make this easier to manage, even menstrual cups have been, introduced, particularly in the rural population, so that it doesn't inhibit them from going to schools or going to colleges, and it makes their quality of life easier.
All right, Dr. Ruchi Tandon, my question to you about the physical discomfort of menstruation. So, the physical discomfort for menstruation can sometimes disrupt your daily life, including work and education. So, can you share your medical insights into the challenges of that women face in balancing their professional and academic commitments with the demands of menstruation?
As a gynecologist, Oshi, we see a lot of young patients. And like I previously said, there is a lot of taboo around the pain of menstruation or around the symptoms of menstruation. Now, through this media, I would like to enlighten our viewers about what is normal menstruation. Normal menstruation is a period which comes during a duration of 28 to 32 days and can last for 3 to 5 days. Pain can be there on the second day of your period. If there is excess amount of pain which is inhibiting you from doing your day to day activities, it is abnormal. If there is a period which is coming very frequently, that is abnormal. If a period is getting missed at a regular interval, it is abnormal. If you are bleeding between the period, it is abnormal. There is no shame in discussing any of your symptom with your gynecologist. We can help you out just by giving you some medicines. These medicines have no long term or short term side effects. And the most common complaint of menstrual cycle is dysmenorrhea. Dysmenorrhea is pain during period. Usually, this is tolerable and it is more on the second to third day of the period. There are certain painkillers which can be given during your periods to improve your quality of life. Now, commonly, you must have seen that people are taking Meftal spas. Meftal spas is completely safe to take during your period, or even Combiflam or an NSAID or a painkiller is completely safe to take during the second to third day of your period. It is not abnormal. Unfortunately, probably, because of the older generation, a taboo exists that nahi, ye normal hai, seh lo, humne bhi saha tha. It is not. And I always encourage the younger generation to be more comfortable. Since they are mostly in demanding professions, taking leave from work is an economical loss to our society as well. And it becomes embarrassing also in workplace. I often get, work colleagues who, pull each other out and say, ki, ma'am, she starts fainting during the second day of the period, or she has so much pain that it becomes an embarrassment in the office also. Women are running around her, all because they don't want to take a painkiller or they don't know how to deal with it. They might be suffering from an underlying condition such as a fibroid or an endometriosis, which is easily treatable. So, if you have any of these symptoms, feel free to discuss this with your gynecologist. Besides painkillers, there are also a lot of domestic treatments or local treatments, such as you can have some calming tea, you can use a heating pad, you can apply certain essential oils to make yourself much more comfortable.
So, like Dr. Ruchi, you just mentioned about menstrual leave policies. So, this question is for all of you. Menstrual leave policies have been a topic of discussion. Could you all provide insights into the current state of the state of such policies in India and how they may affect menstrual stress and women's well-being in different work settings? Dr. Supriya.
I so for From a mental health perspective, it's been a welcome change, because we do think that emotionally sometimes periods can affect us quite severely, and in those days you do what you're it's harder for us to focus, it's harder for us to concentrate and perform up to level. It has also led to a lot of women questioning their abilities, and a lot of people at work coming up saying, that you're not good enough, or that you're not being able to meet your targets at that particular during that particular phase. So taking a break, giving ourselves some downtime, actually has been quite successful for a lot of women who come to us. Having said that, yes, of course, sometimes when corporates and organizations are not, they haven't done the awareness work around that leave, it can lead to further added embarrassment or added shame. So I think it's not just about a company policy that you're coming out with, that you want to give menstruation leave, but there should be awareness also around the other employees, so that there's acceptance of that leave, and people are not shaming the woman for taking a day off, but rather actually being supportive of that.
Vishali, what is your take on this? Yeah.
Well, menstrual leave acknowledges that menstruation is a natural and sometimes challenging part of women's life. It provides several advantages. Firstly, it recognizes and respects women's health. Menstruation can come with a range of physical and emotional symptoms. So, menstrual leave allows women to take break when they need it most without feeling guilty or stressed about work. And secondly, it reaches stress and anxiety. Judging work and serve menstrual symptom can be incredible taxing. Menstrual leave eases that burden, helping women maintain their over well-being.
So, Dr. Ruchi, like we're talking about menstrual leave policies, there is a societal bias amongst people, specifically in men, that if women are taking 4 days of leave a week, they're basically the risky employees, because you're giving 4 days of leaves to a woman employee because of their periods, and they feel that it is unfair on their part. So what is your take on that? And as a gynecologist, how do you want them to be aware of the conditions that women face during these days and how painful it can be? So that is the only sole reason why this leave policy should be in place.
See, women are always better employees. I'm telling you this from my experience, and you can ask this to any corporate employees, because जो औरत घर चलाती है, जो औरत ऑफिस चलाती है, जो औरत सब काम एक साथ कर सकती है, she is much more empowered, and we all know that. That's why we are here even talking about this. That is my first take, and the second take is about the menstrual leave policy. I feel this has to be done at a national level. There are countries like Spain which have, uh, kept this, option of 3 to 5 days a leave per month as a national policy. Now, what happens when you do it as a nation is this element of judgment or this element of shame is always, it is surpassed. When we do it at corporate level, like my colleagues have already said, there is some amount of embarrassment, and then obviously that biasness comes in. So my take is this has to be coming from a national level, and the second take is, even if it is not at a national level, it has to penetrate into our society, in terms of it has to start from schools, from colleges, it has to go into corporate offices, and this should be made as a new normal. I don't think taking 3 to 5 days of leave per month will affect your overall performance of 30 days. There are always ways to compensate it, and likewise, I say the same even about your pregnancy leave. That even 6 months of leave will not change your career in any form. And definitely, again, I'll stand by what I said. Women are better employees, and this should not create a biasness in any organization. And touch wood, by God's grace, I think women are doing very well in every sector, whether it's government sector, whether it is a private sector. They have, taken all positions, and there is almost no field that is, without women.
So, as you mentioned that we should exercise this menstrual leave policy on national level, recently Women Reservation Bill has been passed. So, how do you see the role of women in power with the recent passage of the Women's Reservation Bill in shaping policies and initiatives related to menstrual health and mental well-being? So it will come from a woman to women for women. So how, this question is for all of you guys. How do you see this Women Reservation Bill passing as a light of hope for these menstrual taboos in our society?
See, there are two ways to look at it. Again, sorry, I'm taking the liberty to answer your question the first time. There are two ways to look at it. Of course, like you said earlier, there will always be a biasness. ठीक है, मतलब people who don't get to taste the cake will always feel कि इसको तो एक advantage मिल गया है. But I think there's no harm in that also, because like we know, our country has a rural population and an urban population. It is important to empower our rural population by taking these kind of steps so that they come out of their comfort zone and contribute to our country as a whole. As far as the urban population is concerned, I think women are already quite informed, and within our, again, coming back to what I said earlier, within their designated roles, they need to be assertive and they need to continue doing whatever they're doing without, even thinking of the fact that they are undergoing menstruation. And if at all it is an abnormal period, you can always take any form of consultation from a medical person, particularly a gynecologist. There are so many ways in which we can help you. Our aim is always in providing a better quality of life.
Dr. Malik, please share your insights on this.
I think the Women Reservation Bill is helping us starting to think about that piece of that women accepting that women are another gender, and that women need to be given the same acknowledgement that men have been given or men have been asking for so many generations and years. At the same time, I think the reservation bill is helping us, will, I hope, help women not question themselves as much, but actually go out there and feel that confidence that they can also do things, and they have the scope, or they have been given the platform to now start exploring and to be able to actually achieve what they feel and what they dream about. Having said that, coming back to issues around menstruation, I think with the Women's Reservation Bill, one of the key things that we would want to see is the stigma, and awareness increasing and stigma decreasing, and along with that, starting to accept that menstruation is a difficult period, not just during menstruation but before menstruation also. We haven't touched upon this topic of PMS at all, till now in this discussion, but PMS can be a very, very difficult time for a lot of women. And actually for us, as psychologists, that's when they come into our, clinics and centers, rather than just during the periods, that PMS time, which can be very, very challenging. So, understanding it in the entirety, rather than just thinking of it in those, 2 or 3 days or 4 days or 1 week, we have to understand what it's doing to the woman as in general with their physical and emotional health. And I think with this reservation bill, that's going to become a huge, that can be something like a stepping stone for us to go forward towards awareness.
Thank you, Dr. Malik, for highlighting the word PMS, which is often termed as something that often excuse in the society when women say that they're PMSing, or sometimes it is even used as an insult. If you're like overwhelmed with your emotions, somebody would come up to you and say, "Oh, you're PMSing," without realizing that the woman is experiencing multiple mood swings and multiple physiological conditions and mental conditions where she has no control over her emotions. But still there is this taboo that this is something that people endure. This endure terminology that people have towards women, that they can endure PMSing. And what is your take as a psychologist on this, that this is something that needs to be highlighted amongst men, that PMSing is also not easy. If experiencing periods is not easy, so is PMSing. So what is your take as a psychologist on this?
Absolutely. We so if you look at the statistics itself, uh, most women will go through PMS, and 40% of the women who are going through PMS can have very severe PMS, which we call PMDD. So, which is premenstrual dysphoric disorder, and that is a very serious condition that women can go through, which are signs and symptoms of depression and anxiety. So one shouldn't be ignoring it. As a woman, please don't ignore your PMS symptoms. And two, for men, that acceptance of the mood swings, I think, has been the most challenging. When we work with couples, especially, and you hear what husbands are saying or partners have to say about the PMS time, it's managing those mood swings. But what we often tell the men is that even the women cannot manage their mood swings. So how can we be supportive as a family, as a community during that time is going to be really, really crucial. So it's a lot of not just the awareness work, but also understanding for people how to be supportive. What does that look like? What does that mean? What does it mean to give space to someone, or what does it mean to be there for someone? I think those are just things that as psychologists we talk about. But yes, like I said, PMS is real. PMS is hard, and PMS is a time where women need a lot of support.
Dr. Ruchi, from your medical experience, what is the link between menstrual stress and mental health disorders such as anxiety and depression, just mentioned by Dr. Supriya Malik? How important is early recognition and intervention in such cases?
See, like I said in the beginning, that stress and menstrual, symptoms, they have a deep connection. What happens is when we are stressed, there is an increase in endorphins, there's an increase in cortisol. This causes, a derangement in your estrogen, your progesterone, and this can lead to a lot of other symptoms. For example, it can lead to exaggerated PMS, it can alter your menstrual cycle itself. Like I already said, it can lead to an absent period, which is the most common thing. We see a lot of young population, particularly the younger, burdened population who are busy in their, workspace, and probably, women who are undergoing some exams. The most common complaint that we see is, I've missed my period, and most likely this is because of stress. And this can be easily managed by relaxing techniques, such as by simple things like exercise, by taking adequate sleep, by decreasing your intake of caffeine, by decreasing your alcohol, by avoiding smoking, by leading a healthier lifestyle. Now, what happens is a lot of these symptoms, they go unrecognized, or people think that this is probably normal, and they continue to undergo these symptoms till it becomes a proper pattern. Now, when that happens, that in turn leads to an increase in stress. So it's almost like a full vicious cycle. Whenever you feel that you are experiencing any of these symptoms, it's best to discuss this with us, because sometimes, besides your stress level, it can be something pathological, and that is where your medical practitioner or your gynecologist should intervene. And if you feel that you are unable to get adequate support, please speak to somebody who can understand these symptoms. Like, we had a very heartful discussion about PMS. It is not normal, you know and women unfortunately are taught that this is normal, period se pehle ye hota hai, sabko hota hai, which I think it should not be made as a normal thing. Women should feel empowered to say that I am not feeling normal this period, and that should be made the new normal. And they should be able to say this freely, either to a male colleague or even their own female colleague. And that is where I feel that it's very important to have education and awareness. And it has become very common for women to miss their menstrual periods, probably because of increasing level of stress in our society, because of their workspace. So always discuss this, and you can always seek for help.
Like you mentioned, seeking help. So there is a important discussion about accessibility to the assessment and therapy services. So Dr. Malik, could you elaborate on such services can be made more accessible and inclusive for women dealing with menstrual stress?
Yeah, so what we have ended up doing is we work very closely with gynecologists, and I think that's the most important first step as psychologists and counselors. Where, of course, gynecologists are going to be the first point of contact for people, right? For women to come and discuss their menstrual issues. And it is like what Dr. Ruchi said, it is going to be the gynecologist who's doing the full evaluation and assessment, who kind to see whether they want to involve any other specialists at this point, or the woman needs further support. And so, having a counselor or therapist on team for gynecologists is also quite empowering, because then they are able to understand from a mental health perspective what kind of assessments are going to be important to make sure that we're not missing out on any mental health issues that may be coming up, but they're not full blown issues. So that is one. The other thing is that, online therapy has become really, really successful. We've been therapies have been online for last so many years, but COVID, of course, has helped people accept that online therapy is acceptable and effective. So, please access therapy, because therapy is now available very, very easily. It's about us feeling confident of just turning on our cameras or phones and saying hello to a new person across. And it's no longer the stigma around going to a psychologist or going to a psychiatrist's office, because no one is able to see or know. So that, of course, has helped us making all of these services more accessible. The same goes for women. We have women reaching out to us from all areas of the country, and even different geographies, where they have been able to openly discuss issues around menstruation, issues around acceptance of the family during their difficult periods of PMS, etc. So both of these would be things that I feel women need to be aware of, so that they know that accessibility is there.
So my question to all of you is, it is very important to create a supportive environment during menstruation. So how can healthcare providers collaborate with other stakeholders such as schools and workplaces to foster such an environment? Vishali, please answer this question for us. You can go first. I think I think no audio is not.
Yeah, sorry. So I think by creating some self-awareness campaigns that they already doing, but I think weekly, yeah, monthly, every on especially rural areas, if they create and told the girls that it's very natural thing, it's like a sunshine. Menstrual cycles are a sunshine. If they told them and tell them ki, this is the common problem, you are not the only one that you are facing these problems, so I think they can easily relate with us, and by doing that we can create a good environment when it comes to menstrual health.
So, Dr. Ruchi and Dr. Malik, how healthcare providers like you collaborate with schools and workplaces, and create an environment for women to come up to you guys or come up to their managers and talk about the challenges that they face during their workplaces or while they're they're in school. So, how can health care providers collaborate with the schools and work environment to provide a more bigger platform for these women to come and share their
Oh,
thoughts?
Oshi, I would like to answer first. As you know, we have an organization called as Queen's Gynecology, and the whole idea of creating, Queen's Gynecology was to avoid the embarrassment of going to a gynecologist chamber or to going to a hospital where a gynecologist is sitting. See, when it comes to menstrual disorders, no, they are generally a young population, and there is a lot of taboo in seeing a gynecologist at a young age. Not just women, but even, mothers and sisters, they discourage, from going to a gynecologist directly. One very important thing said by our doctor colleague is that we have to, promote online consultations to make the accessibility, and especially in the younger population, sitting in the comfort of your home, you can speak to a specialist who can, give you simple therapies that can improve your quality of life. And of course, we need to, collaborate with schools by maybe doing, monthly meets or even a yearly meet and telling children what are abnormal symptoms. Sometimes even mothers, they know this about their daughters and they, ignore it, or, they just take over the counter medication. And we see, sometimes, girls in an advanced stage, like, they might be having an ovarian cyst, or they might be having endometriosis, and these things go unnoticed because of, lack of knowledge. So if we start doing this at school, college level, of course it takes, a lot of, initiative from even our part as well as from the schools and colleges part. But of course it will improve the overall quality of their lives. And women have to be empowered enough to opt for, maybe an online consultation, or just speak to somebody who can understand their symptoms. So this is where it all starts.
Dr. Malik, like Dr. Ruchi just mentioned, understanding the symptoms. So, as a psychologist, you do understand where they're expressing their emotions and how periods can play a part while aggravating their stress levels. So, how do you feel as a healthcare provider? How, as you can collaborate with different stakeholders such as schools and workplaces to create a more better environment for these women to come and talk zones.
Oshi, so at Embrace, we've been doing that already, where we are partnering with different schools and with corporates as well, to help women first become aware of the different phases of life and different stages of during the month that they can experience low mood, stress, etc. The other thing that one talks about often is how can I speak up, gaining that confidence that speaking up, sharing, talking is okay. And like you said, we work with a lot of school counselors. We work with a lot of stakeholders in different schools, like principals, headmistresses, to help them understand that if a girl is going through any challenges, please allow them to come and share, and accept that they might be going through difficult feelings, because it's until and unless adults don't start accepting that girls can also have difficulties or challenges, and it's okay for women, it's okay for girls to come out and speak up about those challenges, we will not be able to see that change. So from an adult level we try and have an impact, and of course at an awareness level we want to try and have an impact.
So, my last question to all of you, as we all strive for a healthier mental landscape for all, what are the key initiatives or policy you believe are needed to promote better mental health awareness and support in the context of mental stress?
I can go first on that, Oshi. So we've already come out with the Mental Health Care Act, which has been really, really, which has actually helped put mental health care to the forefront for us in India. However, I think there's a lot of ground level work that needs to be done, and policies that need to be translated. One of the key things that we passionately think is important is licensing, because there's a lot of people who are out there saying that they're counselors, saying that they're therapists, but they actually do not have the right qualifications to be able to provide therapy or counseling services. So I think that is one of the key things that needs to happen. The other has been awareness drives, where we are partnering with different state level stakeholders. Because of course, as a central level, we have a policy, but what is happening at a state level, that needs to penetrate down further. So I think more and more initiatives from different states around mental health care will improve the status. that we have right now. And finally, mental health care becoming an education program during school years is going to be really important. There are different countries now. The Scandinavian countries, of course, are quite famous for it, but even Dubai, for example, UAE, they're starting happiness curriculums, and they're starting curriculums around mental health care. And I think that is going to be really, really crucial so that people are able to accept, understand, and then take steps to protect their mental health. And also, if they are facing any challenges, to come out and speak about their mental health issues.
Thank you, Dr. Supriya Malik, for giving us such an insightful answer on this. My question to you, Dr. Ruchi Tandon, what key initiatives and policies do you believe are needed to promote better mental health awareness and support in context of menstrual stress? What do you feel should be there in our constitution or in law that will allow more awareness towards menstrual stress?
See, again, like I would like to support what Dr. Supriya already said. It starts with awareness. Because if there's no awareness, there's no point in, laying down any policy or any law regarding, any menstrual leave. So it has to start with awareness. There should be some awareness drives at, probably national levels. And we have to empower our younger generation because they are our future, and they in turn will enlighten the other generations of women that probably there's somebody in their family who has been suffering for years. It is a young one who will bring her to a gynecologist saying, no, this is not normal. So it always starts with awareness. And the second thing is accessibility to healthcare. Like I said, now a lot of people already know कि उनको ये problem है, but accepting it and bringing it to a healthcare provider, that takes a lot of guts also. Okay, so for this, of course, there are a lot of other initiatives available. There's so much of online consultation that is available. Maybe because somebody is a little bit hesitant, or maybe because somebody doesn't have proper access to a gynecologist or to a mental health, proper person, a trained, certified person. So इस चीज के लिए we have to bridge the gaps. And in this, I think in this, the government has to lay down certain policies of who are these authorized people. It can either be a gynecologist, or it can be a certified therapist, or somebody with the right qualification, because there are certain symptoms which have to be identified as abnormal as soon as possible. So this is where our government should intervene. And thirdly, of course, I said this has to come as a national level. That is where this all will be accepted into our society. If it is empowered or incorporated at a national level, there are countries such as Spain where menstrual leave has been made lawful. You can take 3 to 5 days in a month without being questioned by any authority. What happens in certain offices is that there is again a bias. The moment you start taking leaves 3 to 5 days, your performances or something, you start being blamed. There comes a lot of comparisons with your male colleagues, why we should keep her. There is a loss of revenue. These kind of things start creeping in. So once this is supported by some kind of a law, even a state law, I think it empowers women and it improves the economical performance of our society.
Thank you, Dr. Ruchi Tandon, for giving such an insightful answer. I think that both you and Dr. Malik mentioned the importance of awareness. I hope our discussion brings a little bit change and little bit awareness amongst women and men also, so that they do understand what types of different conditions we as women live in. So, on that note, that's a wrap on our discussion. Thank you all for joining us today. This conversation surely brings awareness to the complex intersection of periods and stress, along with all the challenges in between. As we conclude, we invite all of you to share a message with our viewers, a brief message on the occasion of World Mental Health Day. Dr. Malik, I think it would be better if we start with you first.
So we're celebrating this World Mental Health Awareness Day as mental health is a human right. And I think that's the basic message that I would say, that mental health is and mental well-being is our basic human right. So please don't ignore it. Please, come forward and take help.
Vaishali?
Yeah, so my message is if anybody going through any significant stress or anxiety, please know that you don't have to face it all alone. Reach out for support, whether it's from friends, family, or professionals, because remember that your mental health matters the most, and it's okay to ask for help when needed.
Dr. Ruchi Tandon, wrapping up our discussion with your comment.
Yes, I feel that our youth is our future, particularly of our country. And if the younger generation feels that, maybe it is stress or maybe it is some menstrual problem, if they see somebody around and that they think it is not normal, they should empower each other and, bring them forward to the right people. And this will help our country as a whole. And it, of course, it adds to the quality of that individual's life.
Thank you all for being part of this insightful and transformative dialogue.